welcome back to my channel. In this video we are going to discuss about how we need to write mental health nursing exam. So in this video we'll discuss about the pattern of the exam, pattern and format for disease and non-disease conditions, and we'll give you some tips for getting more marks in mental health nursing. So let's dive into this video. First we'll discuss why presentation is more important in nursing mental health nursing exam. It makes the paper in a neat and in a format way, like it follows a structure and standard format required. Like if you are following standard format, the examiner is required, or the examiner will check for the format in the paper. So if you are writing a particular format for long answer and short answer, he have an idea about, something about the subject. Okay, and making a good heading is a key for the writing exams. For example, if you are writing something in the paper, you wrote something, you didn't keep the definition heading and you wrote the definition. It is like, for example, it was like you went to a movie, you watched that movie, but for that movie there is no title, so that you'll come out of the movie, you'll come out of the theater, but you can't say the particular movie name to anybody. If you like the movie also, you can't say, because you don't know the title of the movie. Likewise, if you are not keeping the heading, the examiner, if they like the point also, they don't know which context you are saying. If it is an introduction, they don't know it is a definition. That's why definition is very, very important. That side heading is very, very important while writing any kind of exam for nursing. Okay, now we'll discuss the format. Before discussing about the format, we'll discuss the two types of mental health disease, like mental health formats are there. First is for disease conditions format, and second one is non-disease conditions. That is for steps, principles, role of a nurse, like that. For those questions, there is a different type of format. We'll discuss about the format for disease conditioned questions. First, we need to write an introduction, definition, etiology or causes. Etiology and causes are divided into three subgroups: biological, psychological and social. If you know the difference between these three subgroups, you can write etiology in different. You can keep etiology, and you can write biological causes, psychological causes and social causes. If you don't know the difference between these three, then keep heading etiology and write the causes. Whatever you know the causes for that particular disease, you can write. After that, symptoms. After that, diagnosis. After that, classification. In classification, DSM-5 criteria is not required. You can write ICD 11 criteria. That classification you can write. After that, management. In management, medical and surgical and nursing management. In medical management, try to write therapies and what's the medication for that particular disease condition. You can write counseling. This all comes under medical management. Surgical management, rarely we see in mental health nursing. If there is a surgery for any particular disease, you need to mention. And nursing management, you have to write whatever the role of nurse, what is the nurse can do for a particular disease condition. This all things comes under nursing management. After that, you have to write a care plan for 15-mark question, or for 5-mark question. If the question asked, in the question they asked, write a care plan for amnesia, then you have to write PTSD care plan, write a care plan for PTSD, like that. You have to write a care plan if they ask. For 15-mark question, you have to write health education, prevention and conclusion. For my 5-mark question, there is no need to write health education and conclusion. Prevention is needed. Some questions they will ask. If they're asking for 5-mark, you have to write. Okay, here is the tip. For 2-mark questions, mostly they will ask preventions. So if you are reading any kind of disease conditions, try to learn the preventions. What are the preventive measures for delirium or any kind of mental disorder. After that, we will discuss non-disease conditions or the theory question pattern. First you have to write introduction, definition, purpose And main content, if the question is asked for phases, steps, principles, types or components or applications, that question content should be there in main content. After that, role of nurse, advantages and limitations, and conclusion. This is the format. Take a screenshot or write on a paper, keep a book aside with you, write the format clearly so that you'll have a clear idea at the end of by this end of this video. Okay. Writing tips. Formatting is very important for management, is mental health or any child health. These three subjects, format is important. Use bullet points when you're writing. Don't write in a paragraph way, try to concise the points, make at least 5 to 10 points. And visual aids, try to follow flow charts, diagrams or tables if necessary. Use your creativity, try to write according to the question. Comprehensive points, as I said. And nursing focus, mainly focus on the management of a nurse. Common mistakes to avoid: skipping ICDS 11 criteria, ignoring nursing care plan, missing conclusions, excessive paragraphs. Don't write long or dense content. Try to segregate, try to make minimize the content and write in a point way. And insufficient points, while you're writing also, don't write less points, particularly 2-3 points. Don't write, try to write more points. Okay, at least 5 or 8 for non-disease conditions. If they're asking principles, at least you have to write 8 points. Okay. This the end of this video. We already discussed about everything, like a format for disease conditions and non-disease conditions, and we discussed all the tips, what are the things to avoid. So by the end of this video, you'll have a knowledge about how we need to present mental health nursing. So make sure to follow the format, and I hope this video give you an idea how we need to write the exam. If you like this video, make sure to hit the like button and subscribe to this channel. If you're having any doubt regarding mental health nursing, try to comment down. I'll reply to you, everybody who comments. Thank you for watching this video. Thank you.